what is underlying autism? Autism starts with the whole body. It's not just in the brain. So when we see that there's digestive issues or immune system issues, inflammation, then we want to use diet and nutrition to biohack those systems that are needing more support so that we can actually influence learning and behavior.
You're back on the Dr. Nandi Show, and we've been talking about biohacking. And my next guest says there are biohacks for certain children's health concerns. Please welcome nutrition consultant Julie Matthews. Julie, thank you so much.
Thank you.
I appreciate it. I know we've talked about this before, and your specialty is looking at underlying factors and how to biohack nutrition, using nutrition and diet, right? Tell us about that, especially with children's diseases.
Absolutely. So I've been studying autism for about 17 years. I work with families and I've done some research on it. And so what we're looking at is what is underlying autism. Autism starts with the whole body. It's not just in the brain. So when we see that there's digestive issues or immune system issues, inflammation, then we want to use diet and nutrition to biohack those systems that are needing more support so that we can actually influence learning and behavior.
And kids specifically, what kinds of problems do you see that you can use these techniques of biohacking? I love that we're using the word biohacking for really changes in the way you eat and live. You know, it's really what it's about. But what problems do you see in kids that you can help with this?
Absolutely. So while I've been studying autism, the truth is that children with ADHD, learning delays, all different types of conditions can improve. And these kids don't often just have maybe challenges with learning or behavior, but they often might have skin issues, rashes, sleeping challenges, digestive issues, anxiety. And so when we look at that and instead of looking at the condition, we look at what's underlying that. Maybe they have a certain gene that means there might be more deficient in a certain nutrient. If we can boost up those nutrients, or maybe they have more inflammation from foods like gluten or maybe grains, we can address diet as well. So that's what we're looking to do, to affect the underlying foundations or conditions with diet and nutrition choices.
And again, it's kind of an underlying theme in all of our discussions today. It's been that you have to go to the root cause, right? And sometimes it doesn't have to be this big complicated thing that, you know, pay $19.99 today and then it's, you know, $20 a month for the rest of your month. It may be as simple as changing your diet. What about spirituality, Julie? Do you, especially with kids and their stress levels and achieving that spirituality, does that help in your experience?
I think it's all important. I think, you know, my specialty happens to be the biochemistry side and the diet side, but I still tell people, you know, you have to look at the chemicals in your home. You have to look at your stress levels. And actually, one of the steps of my Nourishing Hope for Healing Kids program is actually having parents do some important self-care. And that self-care can relate, you know, can go out to their children as well, because if we're stressed, they're going to be stressed. We need to take care of ourselves as well and that will also help our children. So I think all of those aspects influence our behavior and even our biochemistry.
And I think that kids mirror our behaviors.
Absolutely.
In order to tell your kids to do a certain thing, eat a certain way, behave a certain way, you have to do it. I love when parents are having a burger and fries and tell their kids to have those vegetables. Or get off that cell phone when that's all they do all day, right?
Exactly. We have to
now
be an example.
You also talk about, you know, we're talking in generalities, but you talk about bio-individuality, meaning not all kids are the same, right? And so tell me about that. How do you use that with biohacking?
Absolutely. So I practice bio-individual nutrition. So that's biochemical individuality. So there's certain things that help everyone, taking out artificial additives, getting the good nutrients in. But one of the interesting things about the study that I was part of a year ago, we looked at some things like multivitamin mineral formulas, fish oils, a healthy gluten-free and dairy-free diet. And we found that to be really helpful for the majority of the kids. But we also looked at carnitine supplementation and some other things. So it turns out that there was a girl in the study and she was actually in a wheelchair most of her life. So carnitine wasn't something that was helpful for a majority of the kids in the study, but for her it was life-changing. It allowed her to get out of her wheelchair. So that's what I mean by biohacking. How do we get to the underlying root cause for that individual and supply them what they need? It can be really life-changing when we can do that.
And I really believe, Julie, that the microbiome has a lot to do with that, because all of us have a individual microbiome. So those who are watching these, all of the trillions of bugs in your intestinal system, I talk about it all the time, are individual, and each of us have our own little signature. So I can imagine if you give a child this or a child that if you give one child with a certain microbiome a certain amount of a substance, it'll be handled differently. So it's really important to understand, again, we're in a society that people want a quick fix, one size fits all, and that's not going to work with biohacking. And in fact, you could, in some cases, really harm somebody, including a child, if you continue to give this. So I think that, learn about what your child is going to respond to, find out tools like the kind that Julie gives to see how you can individualize them. And then also, remember the general behavior, which is take out the toxins, take out the additives, have whole foods, don't have simple carbohydrates, all could play a real role. So thank you so much. I mean, giving hope to folks with autism, one of the most devastating diseases for the children and the parents. Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.